I'd like to take a moment to introduce myself again. I'm Priscilla Calvache. I'm the Assistant Director for Lupus Programs and Community Engagement here at HSS. It's really a pleasure to welcome you all back to HSS. We have not had this program since 2019, since before COVID. So for many of you who are familiar with this event, it's been around for over 18 years, sponsored by the Department of Social Work Programs. So we're excited to be back and continue to grow again next year. So thank you all for joining us back in person. We're so excited to welcome you, and especially to celebrate Lupus Awareness Month together. Let's give yourself a round of applause. All right, come on, you're having lunch, a little louder. So again, I just want to give a very special thank you to all of our wonderful sponsors who are here with us today. We have Jenny Mack, who's providing nutritional counseling, Michelle and Mary Lynn, who are doing blood pressure screenings, Pin Sue, who just completed our Tai Chi class, Nick with the EP event group. Please check out our photo booth. And our hair vendor's a little bit delayed. Hopefully they'll make it today. At this time, we're going to transition to our keynote speaker for this afternoon. So if you haven't had an opportunity to grab lunch, please do so at this moment. We also have PowerPoint slides going around. All right, so Dr. Geraldino Pardilla is an associate professor of medicine and the director of the Lupus Clinic at Columbia University, New York City. She received her MD from Intac University in the Dominican Republic, where she graduated summa cum laude, completed her internal medicine residency at SUNY Upstate University, and a rheumatology fellowship at Columbia University, where she stayed on as faculty. In addition, she trained in musculoskeletal ultrasonography with the Ultrasound School of North American Rheumatologists, as well as the performance of synovial tissue biopsies under ultrasound guidance, and serves as a director of the FAST Arthritis Sonographic Evaluation and Treatment FAST Clinic at Columbia University. Her areas of clinical and research interests include cardiovascular disease in systemic lupus erythematosus, rheumatoid arthritis, and musculoskeletal ultrasonography. And today she's here to talk to us about organ involvement in SLE with a focus on lupus nephritis and cardiovascular disease. So please join me in welcoming Dr. Geraldino Pardilla.
Thanks so much for the introduction, and it's really great to be here. As Priscilla was mentioning, I was actually here for that previous in-person event in 2019, and it's taking a few years to come back to some sort of normalcy, but it's great to be here doing this in person again. So welcome everybody. And these are two very important topics that we'll be covering today. You'll see how a lot of the complications and diseases that stem out of SLE, of lupus, have to deal a lot of the times with the kidney involvement and with cardiovascular disease. So that's where we're going to focus on those two main topics today. And we'll start with lupus nephritis. So as we know, lupus is a condition that can manifest very differently from individual to individual. But the essential problem, or the process that's ongoing, is that the immune system, which is there to normally, defend you from things, an infection, cancerous cells, that same system, those cells that are using our resources to do that, they get confused and start not recognizing our body as our own and start attacking different parts of the body. So that's what is called an autoimmune condition. So it's your immune system that should be protecting you, actually attacking certain parts of your body. And from individual to individual, we see very big differences. Some people with lupus have a rash, other people have some joint swelling, pain, right, arthritis, but really, lupus can affect any organ in the body. So there are some people that have internal organ involvement, affection of the kidneys in particular, and that's what's called lupus nephritis. And sometimes I feel like people think it's something rare that happens. It really isn't. We're talking about 50%. So 1 out of 2 people living with lupus actually gets that involvement of the kidney. So it's really not rare. So it's very important to know about, and it's one of the things that your doctors are always screening you for and monitoring there, making sure that that's not developing. And digging in a little bit into this, so what happens is, just as you see inflammation in other parts when the lupus is flaring, it's really easy to see a rash, right? Very, very noticeable. But when there is inflammation in an internal organ like the kidneys, that might not be visible at all. It isn't really. But that inflammation, the longer it goes on for, it starts causing damage on the kidney. So that's where we run into problems. When the kidneys cannot perform their essential tasks, and this is a major organ in the body, it has very, very important responsibilities for our body. It manages the fluid balance, so how much fluid we're retaining, how much fluid we're getting rid of, and it expels toxins from our body, so it gets rid of waste. So when the kidneys are not functioning properly, those two very essential functions get impaired. We start retaining waste that we should be dumping. We start retaining fluid that is also something we should be getting rid of. And that inflammation process that happens in the kidneys, when it moves on to damage, then it becomes harder to control or even reverse at those points. So it can lead really to damage of the kidney that's irreversible. And then we find ourselves needing things like dialysis, a kidney transplant, because those kidneys are not able to recover at that point. So we really want to try to focus on identifying things more in the inflammatory phase, when things are still inflamed and haven't progressed to damage. So who gets affected by lupus nephritis? We said, we established it's not uncommon, right? So it's 1 out of 2 people living with lupus that gets involvement of the kidneys. But we do see there's differences too in who gets it. So it is actually more common depending on which racial ethnic background you have. So we see it being 4 times more common actually in African and Asian descent. So when you're comparing it to, for example, white people. And there's also twice the likelihood of having lupus nephritis in the Hispanic population and Native Americans. So we screen everybody routinely for this development for the involvement of the kidneys in lupus. But in particular, when we know somebody is even at greater risk, perhaps keeping a closer eye is important to do as well. And like we said, so it's not uncommon when we're talking about numbers of patients. So we're talking about, around 100,000 people currently diagnosed and living with lupus nephritis in the United States. So not that uncommon. And when we look also at, when do people that get lupus nephritis, right, the kidneys being involved, when do they get diagnosed with it? So it tends to be early in the course of the disease. So most of the people that get this involvement will have it within the first 5 years of disease. And actually 1 in 3 gets it as the first symptom. And that, as you can imagine, is even trickier because at least if somebody already has been diagnosed with lupus and, they're seeing a provider, they're being screened for this. But you're young, you haven't been diagnosed with maybe anything, and lupus nephritis is the first symptom. There could be a long delay because you might not be seeing doctors regularly, not sure what's going on, maybe go to an urgent care. So that's even more challenging when that is the first symptom, really, of the disease. And talking about symptoms, we said it's really easy to know your skin is flaring from lupus because you see it. It's not hard to do at all. But when we're talking about involvement of the kidneys, you might not feel anything. It's not very visible at all. It could be very vague symptoms. When we do start to notice some things, some of the most commonly noticeable symptoms are swelling, usually of the feet because of gravity. We see the retention of fluids will start from your feet up. The higher they're going up the leg, up the thighs, then that's actually more severe. It's moving up further. And that's because of that function of the kidneys of getting rid of fluid. They're not maintaining that fluid balance, and then we're retaining it. So with that, you could see how weight gain, unexpected. You weigh yourself, if you are weighing yourself regularly, you see that just put on 3 pounds one day to the next. Usually that talks about, again, that fluid buildup. You're gaining weight because you're holding on to all these fluids. So that could be a sign, that could be a clue. And, changes in the urination, because the kidneys are not working properly, you're retaining all this fluid, so changes in the pattern of your urine. And actually also, sorry about that, the appearance of the urine is something that you can notice. It's not, not everybody will see this, but when the kidneys are affected and you're actually losing protein that you would normally keep, it looks like a lot of bubbles, frothy, foamy. So noticing that change in the urine, you had normal urine before, now it's looking all frothy, bubbly. So that tends to indicate that the kidneys are not working well and that is protein coming there. I'll just remove this in case I'm blocking my face for some people. This could be subtle symptoms. Maybe you're not noticing any of this. So because of this, it's really important to just be screened regularly for this, for the involvement of the kidneys when you have lupus. Like I said, a bit, of course, difficult when it's the first manifestation of the disease, because then those people are not going to be undergoing this. But when we can, we absolutely must do this. So when the kidneys are not working properly, the leakage of protein is one of the main features that we are looking for when monitoring for this. And usually this is what's called, the term for the leakage of protein in the urine is called proteinuria. So your doctors will be talking to you about this all the time. Well, the protein in the urine, the proteinuria now is this is what it was. And it's one of the very simple tests and signs that there could be involvement of the kidneys with lupus. One of the other things we can see, and usually this is microscopic, is seeing blood in the urine. Rare occasions you visibly see it, but most of the times is when the doctors are evaluating you and they just analyze the urine under the microscope, that's where they can see the presence of blood in the urine, and that's called hematuria. So these two things are very simple, parameters that the doctors are just looking at with the urine test. But we talked about how, the kidneys help us regulate waste. So when that's not happening smoothly because of the damage in the kidneys, then we start seeing that also our electrolytes, so things like the potassium that is in our blood, that's usually needs to be maintained at very specific levels, and that's the job of the kidneys. But if they're not working well, you could have, these electrolytes are abnormal, they become high because your kidneys are not doing a good job of at regulating that. And similarly, the term you're seeing here, decreased glomerular filtration rate, what that means is just what is the ability of the kidneys to filter the fluids? Is it filtering the blood properly? If it's damaged, if it's impaired, then you know that it's the ability of that kidneys to filter is going to go down. So that's actually a number that goes down. We're just measuring how good are your kidneys at doing this task. And these are all simple tests that we get from urine and from blood. And that increase of waste in your body, because the kidneys are not getting rid of it, is usually what you'll see measured as creatinine in the labs that you get routinely done. So when you're not getting rid of that waste, then that creatinine is going to rise. So you'll see higher levels of that. And it's like a domino effect. Like the kidneys are not working well, you're retaining fluid, maybe electrolytes are abnormal, the filtration's going down, the protein is leaking. And with the buildup of fluids, usually then what do we have? Well, now the body has to handle all of this fluid. So your blood pressure goes up. And that might actually be one of the first signs you see. Maybe you always have normal blood pressure and suddenly they tell you, wow, your blood pressure is really high today. Well, what could be going on? Especially in a young person without, a lot of other medical problems to explain that. That should be a suspicion and a sign that, well, let's look into what's happening with the kidneys. So, and, the goal of the testing that you're doing routinely, it might feel like every time they are doing blood and urine, but it's really a lot of it is linked to this. We want to see that the kidneys are doing okay because if they are not, if the lupus is causing inflammation in that organ, we want to treat it fast so that it doesn't progress to damage, which is already when the kidneys become scar tissue. You cannot never have that come back and work properly. So that's really what we're trying to stop there. And I was mentioning that domino effect. So it starts with the kidneys, but that leads to complications. So the blood pressure increasing is one of the first things we'll see because of that fluid buildup, and now our body having to manage this excess fluid. That puts a lot of tension on your heart, as you can see, as you can imagine, because that's who's pumping all this fluid. And the chronic kidney disease, that comes when we start getting damage. So we said it starts with inflammation, but if we don't stop the inflammation, promptly, then parts of the kidneys start getting damaged. And if that evolves, then you have a lot of risk with complications of things like heart attack, strokes, because you have your two organs, the kidneys not working properly, the heart trying to compensate for this excessive situation that's happening with fluid retention and electrolyte abnormalities. We said, when the kidneys are not regulating things, maybe your potassium's really high. Well, that has implications on the heart too. It can cause your rhythm, the heart rhythm, to go off and into abnormal things that then put you at risk for things like heart attacks and strokes. So it's a cascade of potential complications. And ultimately, when the kidneys are, irreversibly damaged, then that's what we call kidney failure. And that's really at the stage where we need to resort to things like the dialysis or getting a kidney transplant, because that organ is beyond treatment at that point. So let's talk a little bit about that road to the diagnosis. We said the symptoms could be subtle, right? But regardless, we are screening for it regularly because we want to make sure that that's not ongoing. So what are those important tests that your doctors are doing routinely? And we usually say it's important to do it at least every 3 months. So even if you're feeling great, we want to check. And the main reason is if there is a problem, it's good to treat it promptly so it doesn't progress to the damage. We want to get it in when it's inflammation that can respond to treatments. So in those tests, this is a nice summary. We said the urine test. Again, the most important feature we're measuring in that urine is if there's leakage of protein. So that's something that is easy to measure there. Usually if it's somebody that has already been diagnosed with lupus, the rheumatologist will be doing this, like we said, at least quarterly. They'll be checking on this, but there are some people that are also seeing a nephrologist, especially when the first manifestation is nephritis of the lupus, so maybe the nephrologist is doing this. And often, when you're in a lupus center, both the rheumatologist and the nephrologist are working together to follow and treat and diagnose when needed. And usually you do this labs when you go for the routine visits, and it's something that, again, at least every 3 months, we really want to check so that we are not running behind in treatment if it's needed. And, and I think I probably mentioned this in the previous slide, but it tends to depend on which is the main initial symptom that you have, where people end up which provider the people end up seeing first, the rheumatologist versus the nephrologist. If it's a severe case, usually in the hospital, we both tend to come at the same time. But regardless of who's first managing the condition, it's just essential to be doing this routine testing. And often the work in combination, this is not a disease that affects only one thing. So it's very important always your rheumatologist will be closely working with the nephrologist when it's a problem with the kidneys, with the cardiologist when it's a problem with the heart. So it's always a multidisciplinary team that we will be relying on. And this slide nicely summarizes what are those essential tests that we are using to diagnose lupus nephritis. So we talked about the urine test, and 2 essential things we were looking at there, the proteinuria, so we're actually measuring how much protein is leaking, and we can see also blood in that urine, the hematuria. Most of the time, like I said, it's really microscopic, so your doctor will tell you that they saw that. The blood test, because in the blood test, that's where we can measure the ability of the kidneys to filter. It tells us that number. It tells us how much waste is being retained, how that creatinine is increasing because we're not normally eliminating it. And these two essential tests, the urine and the blood, gives us a good clue that, okay, we have to really consider that there's lupus nephritis happening here. The confirmatory test is the kidney biopsy. And I know that sometimes it's felt like, can you just start treatment with looking at the urine and the blood? Do I really need to undergo a biopsy? And it sounds like it's a biopsy, very invasive procedure. It's really a needle that's done under an ultrasound guidance. So not to minimize the procedure, it's still a biopsy, but it's relatively, it's done as an elective procedure. They do it like in 15 minutes. It's under anesthesia, you have anesthesia, so this is not something painful, and it is very informative. Even though we have the urine and we have the blood tests, the kidney biopsy tells us a lot of other things. How much inflammation is there versus how much damage already is there. There's also different kinds of ways in which the lupus can affect the kidney. It tells us that, and then we can decide on which treatment is better for you in particular, because you have this kind of lupus nephritis versus another kind of lupus nephritis. And also, should we do a lot of immunosuppression because there's a lot of inflammation? Or maybe not, because we're seeing there's actually a lot of damage already. Maybe we need to focus more on like controlling blood pressure, other things, and not put you at risk of getting all this immunosuppression if we know there's not a lot of inflammation there that we can actually reverse. It gives us a very good idea. And probably some people here have heard of antiphospholipid antibody syndrome. So that's like a clotting problem that can be sometimes seen in people with lupus. Well, that could also happen then and affect your kidney. So the biopsy would tell us if that's what's happening, maybe. Not inflammation, but actually maybe it's a clot in those kidneys. And then that would be like blood thinners that you would want to have on board. So it's really informative. To tell us exactly what is happening throughout the kidneys and how to best treat it. And the magic number, or, there's been so many studies looking at what would be a normal level of protein in the urine. But it is clear that when we start seeing that the amount of protein that we're leaking through the urine, when it's greater than 0.5 grams, that's really when we need to, go with the full workup and be suspicious for lupus nephritis. So this is something that you can keep track of, especially now that we have electronic medical record systems and patient portal. You could just see, your doctor for sure will be discussing your results, but you can see, is it less than this? Is it greater than 0.5? Or if you've already been diagnosed with lupus nephritis, then you can track down how you're responding to the treatment. How is this number decreasing? How am I doing? So, and similarly, for this stands, eGFR stands for the estimated glomerular filtration rate. That's when I was saying it's just how well are the kidneys at filtering. So that number, when the kidneys are not working properly, goes down. They're not filtering well. So that number you can also follow. Usually when it falls below 60, then we know we're in trouble. Then we know that's abnormal and we have to further work that up, and we need treatment. What do we need to do to try to improve this filtration of the kidneys? So that's another, those are two easy numbers to, think about, monitor, follow when you're getting all these labs done at your regular visits. And like I mentioned, the kidney biopsy, which is at the end of the day, really our best resource to diagnose lupus and give us all the, diagnose lupus nephritis and give us all the information on what is the status at that given point. What should be our goal for treatment and what should be the best treatment that we can do at that point. And, the management of lupus nephritis, you probably know it comes with very different flavors and very different types of medications that can help us. So some of those are based on the immunosuppressants, those medications that try to control your immune system, bringing it down so it stops causing that inflammation in the kidney. Steroids, as you know, as much as we don't want to use steroids for a long time or very high doses because of all the side effects, the steroids are the one thing that work in 24 hours. So we always start the steroids when we need to calm inflammation down very fast, but we try to taper them, go down on them as fast as we can. But they are really cornerstone in helping us treat especially severe lupus manifestations where we want to get inflammation under control fast. We want to control yesterday. So we start the immunosuppressants too, but the immunosuppressants are slower acting. So they take time for you to really see that response. But once they kick in and take over, that's when we can then start lowering the steroids so that you don't have to run into side effects and complications from them. And you'll see that even if you don't have high blood pressure when you have lupus nephritis, we tend to use blood pressure medications. So the reason for that is because there are certain blood pressure medications that actually have protection for the kidneys. They help with that leakage of protein in the urine. So even if the blood pressure is normal, when you have lupus nephritis, it's good to be on one of these medications. Of course, we have to make sure your blood pressure doesn't go too low, and we'll have you checking on the blood pressure so that the dose is, at a tolerable state. But you have that extra protection for those types of medication. The antimalarials are the medications like the Plaquenil or chloroquine. So those are always, our best friends. Your doctors are always telling you stay on them, even if things are in remission, even if the lupus is very quiet, because they actually not only help prevent any kind of flare in lupus, but in particular, the kidney flares. So they're associated with greater survival. You live longer if you stay on that antimalarial. Yes, we have to go to the eye doctor once a year to make sure it's not causing any problems there in the retina, but a lot of benefits from it. And protecting against having flares with the kidneys is one of the very good ones. So these tend to be some of the essential medications that you will be put on when lupus nephritis gets diagnosed. But it's not all the part of the medications, of course, right? This is a condition that requires working with a multidisciplinary team of doctors. Like we said, you have your rheumatologist, you have your primary care provider, you have the nephrologist who did the kidney biopsy and is following up. And depending on what else is happening, counselors or other organs that are flaring, it's really having that team of doctors, right, available for you. Anything that's happening, you're already an established patient, you know them, you know that everybody is looking out for each condition or manifestation that could be ongoing. So living with lupus nephritis, it's a big, of course, change in life. You're looking at all of these things. You might feel overwhelmed, all these appointments, all these providers. And I always tell my patients that will happen, but you do want all the help we can get. We want that, and we want that now. It's going to get easier once we're under control, but especially at the initial phases of diagnosis, you do want to make sure, you're getting all this help. You're doing everything we can to get those kidneys back to normal state. So learning about what are those indicators that maybe things are not going well. Yes, you're seeing your doctors regularly, but you might notice some of these things in between appointments, and maybe you say, oh, things looked okay, but I just noticed my urine is looking so foamy. My blood pressure started to go higher. Do you think maybe should I come and see you earlier? Anything that's happening, it's the more you know about the condition, you're partnering up with your physicians, then we have more detectives doing this job and better results because we can target things earlier as soon as they are identified. And diet and exercise, not to be forgotten, of course, very important, as well as just a general healthy living, mental health, learning to manage all of these tasks, appointments, things that we have to do, how to best go about that. And like I was mentioning, it's really a team effort. So you might be seeing a lot of these different providers, and each of them will be, offering their expertise in X, Y, and Z in the particular areas where they can further help. Sometimes, if you need a dietitian to have, a better control or a better help plan what should be your best diet, for example, to follow. That could be quite helpful. And it's not, we're human, it's not unnatural to feel overwhelmed if you're told suddenly, we're worried about your kidneys and there's all these medications you have to take. That could, sometimes bring us down a bit. So it's not, it's not a bad idea to, if you think, I just cannot deal with all of these things, to see a psychologist, get some help. We're going to get better, but once we're through that difficult phase, all the help that we can get is should be embraced. So, and I think it's sometimes good to have some tips or just make a conscious effort to keep some of these things in mind. How can I make the best out of working with my healthcare team? What are some of the good tips that I could be following to make this easier? So, you're always your best advocate, and nobody knows your body better than you. So as much as we're trying to help, you're the one who knows if things are going wrong sometimes, and you might look good. Especially, lupus is a disease of young people. And that's a common mistake in medicine, especially in providers that are not used to seeing lupus. They see a young woman that looks perfectly fine, and then sometimes symptoms even tend to be, minimized, like you're okay. But you kind of know that that's not the case, and sometimes it takes people several urgent care visits, a big delay in getting a diagnosis, because you look good, but that's what being young is. You look good, but you might not really feel good, and a lot of things could be going on. So yeah, being your best self-advocate. You don't feel good, and this person is dismissing me, well, I'm going to see somebody else, because I know this is not right, and I know something is happening. So that's something we have to unfortunately fight for, because you hear this all the time, that there's that delay, and it's because they think you're young and you're doing okay. But no, young people fool you like that. So we cannot take that. So, and keeping track of the appointments and hospital visits, that could be a lot, especially when it's a new diagnosis. The rheumatology appointment, the kidney doctor appointment for the biopsy, the follow-up for that, the labs, got to go pick up this medication. So I think the phone, this is one of the best things. I hate the phones, but the smartphones are really great at keeping track of all of these things, because it's impossible to otherwise keep all that in your mind. Put alerts for anything that's really needed for. Remind me 2 days before I have to go where. Everything written down there in detail. It might be different buildings, different hospitals. All these things could be in very different places. Nobody can keep track of that. So having that very well organized in your phone, I think, goes a long way. Writing down your symptoms. So usually you're seeing your rheumatologist every 2 or 3 months if everything's relatively controlled, but something might have happened in between those weeks, and you're like, yeah, I'll tell them, but maybe you forget by the time the appointment comes. So if you think you're not sure what that was, maybe it's important, maybe it's not, just write it down and just bring it up, because it might be. Maybe you were saying that what you were feeling was an indicator that maybe the kidneys are involved or something else. So if you're not sure, write it down, make sure that is looked at, or, send a message through the portal. That's one of the perks of the portals. You can directly send your doctor's messages, and I love that. And then you get that immediately, like a text message, and you can act, without any delays. So that's a good thing. I think, the seeing your results, again, the portals make that easy. The electronic medical record system, you can just see the lab results, and you can hit all, and you can see the trend of how things are going. Are they going in the right the right track, or are they actually not? So it's nice to have that, and then you can discuss that with your doctor. I mean, it looks like my protein has been increasing a little bit every time. What should we do about this? So you can own that, know what's going on, and bring it up for questions and make sure that you're on the proper treatments. Which brings the next point of bringing all the medications. It could be a lot. We mentioned immunosuppressants, steroids, blood pressure medication, antimalarials. So it piles up. Maybe because it's so many of them, maybe you're taking one of them wrong. So it's just good to bring them. This is how I'm taking them all. Is this the right way? Or, other medications that maybe some other providers gave you, just to make sure nothing interacts, there's no problem taking them together. So it's always nice to, either have your list of medications or just bring them all, and so that we're all on the same page on how things are taken and what you are given from other providers as well. And because there's a lot of information, it's a lot of different things, it's very helpful to bring someone with you to the appointments, I think. Yeah, it's an extra person there who might actually offer information. Remember what happened to you the other, so might help you not only keep track of what all these appointments and things that you're being scheduled for, but actually remind you of some things you might be missing to mention during your encounter. And just, it has to be a very good report. You have to feel good with your rheumatologist because it's going to be a long-term relationship. This is somebody who's going to be following you until, forever. So you want to make sure you have that openness and you feel okay about asking questions. Look, what was this medication for? Do I really need this? Just anything. Because you don't want to, feel restricted and then not be too adherent to your medications because you are not just sure about them. Just any questions, any doubt, just bring them up to your doctor. Maybe you're not tolerating them well. Well, let them know. They might change it to something that you can tolerate better. Rather than maybe stopping it, let's not bring it up. I'm taking all the others. Maybe that's okay. No, I know it's tempting, but no. And I think, we're doing better. It was a difficult time during the pandemic. A lot of people felt like the access to their providers was limited and hard to be seen and all of these things. But thankfully, I think this is changing and we're back to full in-person encounters and not having so much of those restrictions anymore. But one of the things that did come with, with the pandemic was telemedicine and these video encounters, right? At first, I know we all hated them. Nobody was happy with just doing that. But you know what? It brought up actually some benefits because maybe, let's say you were going to not show up for the appointment because you're not feeling well. Well, now we could do a video and it's better, right? Maybe we still have to schedule the labs, and that's one thing we have to keep in mind, but maybe even do the labs locally. But at least you still have that evaluation. And there's some tips. I don't know if people are still doing some of these video encounters. We still have some, and that's the main use I've seen for them at this point. Like, let's say, you were not going to be able to make it, live, you planned, but life happens, it gets too hectic, but it's easier for you to just connect for maybe 15, 20 minutes, and then we can still make a plan and say, what, do the labs locally so that it's easier for you. You don't have to come here, but tell me what's going on. And there's a lot of information we can actually gather from that. Obviously, you can, with the video, you can see, you have good light, so we can identify rashes. We can even see if there's ulcers in the mouth. Show me your joints, do this, do that, and we can try to figure not everything. If you have a blood pressure cuff, I can ask you, check your blood pressure, read me the numbers, how are things going there? So you could still get, a lot of information from there. So it's important to make good use of this as well, since we have it now. It's just another resource we can have. And I talked a little bit about, so the medications is an important, of course, important part of the treatment. What about other things? So we know eating right. There's no specific lupus diet, which is a common question we get. But we do know some of the things that are happening, right, with the kidneys, the blood pressure. So knowing that and the risks that come with cardiovascular disease. So we want to make sure then that we do a diet that helps us with those kinds of problems. So, the worst things are usually the processed foods and the high content of salt. So those are things that we absolutely want to avoid because we said here we're likely dealing with complications of high blood pressure, retention of fluid. So that's what high salt would do, processed foods would do. So we want to try to stay out of that, away from that. And so the healthy is, just in general, thinking about your kidneys, thinking about cardiovascular health. Some of the good things you want to do is rely on like your protein being more like white meat, fish, having most of your plate abundance in vegetables, and having the healthy fats, because we want high omega-3 concentration. So our healthy fats usually are things like olives, avocado, nuts. So trying to have those being your predominant fats that you're eating on a regular basis, and considering exercise, and it's for many reasons. So not only is the exercise strongly recommended when we are on doses of steroids, because the steroids, they're great at calming down inflammation, but some of the other things they do, they can make your muscles and your bones weak. So especially when on high doses of steroids, we want to be up and around. We want to be working out because we don't want now our muscle mass to turn into fat, to be atrophied. So that's even a more important time. And I realize that's when it's harder, because if you're on high doses of steroids, it's because you're not feeling well, but we gotta try to do as much as we can physically so that the steroids don't give us those complications. But also, besides the benefits that steroids have for the purpose of the steroids, for the purpose of just healthy cardiovascular, right, good for your heart and in general, also for your mental health. I mean, all of these things are going on, all these appointments, all these medications, this, that, and life is still happening, the kids, the work, all of these things. So exercise also helps a lot with that mental health. So trying to, take that time for you to relax. And, there's no contraindication in which kind of exercise you can do. We like to say, things like walking, swimming, something cardio related. But as long as, you're able to do the exercise and just being cautious not to harm yourself, no extreme things where you could injure yourself, it's always a plus to have as part of any, a treatment plan. And I think I keep emphasizing on you being your best advocate, and absolutely that's the case. So these are just some tips on how to, what kind of things you can bring up when you're in your appointments talking to your doctors. Especially now you're all savvy in which are the things we're looking for in lupus nephritis, the protein level in the urine, the filtration rate for the kidney. So these are things you can ask, how are those doing? Is that doing okay? If you've already been diagnosed with lupus nephritis, so how am I responding to the treatment? By the way, my biopsy, was there a lot of damage already there? Or is it mainly, inflammation? Just this is your health, so you can know all of these things. When are we measuring how the kidneys are doing again? What other complications are we facing from the kidneys being involved? Should I have some tests for the heart? Is that doing okay? My blood pressure, is that doing okay? What are other things that we can do? So it's just some general questions that can start those conversations. The more you know about how things are going, the more you can intervene or do something about it. So it's always good to start these kinds of talks with your doctor. And this is a bit of a summary, on you keeping informed on learning about at every step of the way how from the point of diagnosis, understanding just your risk before diagnosis. Now we said 50% of people living with lupus. So then maybe you've never had this, you want to then talk to your doctor. My kidneys, have they been doing okay? Yeah, has there been any concerns there? What are you looking for? And the urine, the blood, how your kidneys are functioning through those tests. Discussing what is happening, what are your treatment options, what are the best options. And you're here learning about this. The more you learn, the more you feel comfortable about, owning your disease and knowing how to best be your advocate and approach your doctor about things. Your doctor has always your best interest, but you know your body best. So it's always good to stay informed. And with that, I think we'll transition to you put it here? I just do that? Oh, okay, I see. Nice. Good. So with that in mind, we'll talk a little bit deeper about cardiovascular disease. We saw how it's very linked to the kidneys, and there are some figures here that I'll show you about that, about what happens in general. We know that, when we talk about heart disease, it's something that it's not uncommon either in people living with lupus. When we look at people with lupus and people without, we see double the risk for having heart disease. And keeping in mind that, lupus is a disease of young people. So this is not the age at which heart disease is common by any means if you did not have lupus. So it's important to then look at what is happening. What are the risk factors? Why is heart disease occurring in young people with lupus? So, and we've done very well, thankfully, throughout the years. Like if you see these curves, and I think I have a pointer here, or do I? No, maybe not. But if you see these curves, in the 1950s, people were diagnosed with lupus, and in 5 to 10 years, the survival was only 50%. That was terrible. Talking young people diagnosed with this condition, and only half of them would be alive in 5 to 10 years. Thankfully, we're very far from there. We're in the high 90s. So that's much better, and that's thankful to, developments in the field, the medications we have. But still, it should really be very close to a 100%. Because, again, we're talking about mainly young people. So still, if you compare people with lupus and without lupus, people with lupus have 3 to 5 times greater risk of death. And why is that happening from heart disease? So as we're living longer now, we see that heart disease becomes a more common cause of death in lupus. And these are the way to look at this. You see the line in the center. Anything that goes to the left means that people without lupus are at greater risk. If it comes to the right, it means that it's people with lupus that have greater risk. So these are different studies looking at what's the risk for a heart attack. And you see that most of the studies, you see the dots are on the right side. So we see that, yes, there's greater risk for heart attacks if you have lupus. And the shocking thing was if you look at the circle I have in the bottom there, we're talking about the group that's 35 to 44 years of age. So very young women have an extremely higher risk when they're compared to people without lupus. And it's because of what I said. You don't normally expect to have a heart attack in a young population like that, 35-year-old heart attack. That's not really something that we tend to see. So looking at things of, what could be contributing to this? So, and what is the likelihood of people with lupus having, for example, heart failure? We mentioned the heart could be, overwhelmed with things like lupus nephritis and other issues that we're gonna be looking at with lupus. And what you're seeing here in the blue dot is the risk for males. The red dot is the risk for females. And you see in the lupus lines are the ones on top. And you see that the risk compared to the people without lupus, for these people here, the difference, right? For both male and female without lupus, male and female with lupus. So big difference in terms of looking at risks for heart failure. But look when you factor in the nephritis, and that's how I said this is so linked to the nephritis. The yellow line you're seeing in the middle is people with lupus, and you see they have greater risk than the people without lupus right here, the blacks. So people in general with lupus higher, but if you have nephritis, look at what happens here. So clearly the nephritis is very linked to this risk of heart failure because of the things we mentioned. You're retaining fluid, the electrolytes, these things are happening. Who's getting affected? Which organ is predominantly getting affected by that? The heart. So that makes it so important. And what are these risk factors? So, people with lupus can have, of course, the general risk factors too, like if we know males are a greater risk for heart disease, smoking, if you have high cholesterol, you have high blood pressure, those things are common, right? Risk factors for heart disease and heart failure. But if you have lupus on its own, having lupus, it gives you triple the risk for this condition. So there's a lot of studies looking at what is it that is causing this? What is it about lupus on its own that is causing this? And some of the things we can see, even, shortly after diagnosis with lupus, young people with lupus, that something that happens is an acceleration of what's called atherosclerosis. What that means is that fatty streaks and calcium gets deposited into the blood vessels, and that's what's depicted there in the cartoon. Normally, your blood vessels should have none of that, right? Clean, no deposits of this yellow fat that the image is depicting. But as you start having these deposits of fat, well, that lumen, the blood vessel, then starts shrinking, and you don't have much space for the blood to flow. When it becomes very important, very impressive, then you might not have proper blood flow to that organ. If it's the heart, not proper blood flow to the heart means a heart attack. So that's something that we know happens 2.5 times higher in lupus, and it's because of the inflammation. When there is inflammation in our body, well, that leads to this phenomena of fatty and calcium deposition in the blood vessels. And it's something that we can actually look at just with an ultrasound. That's what we're seeing here. You see, this is just the blood vessel right here, and you see this thing deposited there, which are the fatty and calcium deposits. That's what we call atherosclerosis, and we know increases the risk for heart disease. So that's something that we see happening more often there. This is a CAT scan in which what you're seeing bright there, those three lines with the brightness, those are the calcium deposits, the fat with calcium deposits too in those blood vessels, and that's the heart, so that's to the vessels of the heart. So we, of course, want to monitor this so that we don't find ourselves at risk for heart attacks. But really, the inflammation can happen in the blood vessels through that phenomena, but also in any part of the heart, in the valves that help control the flow of blood from each part of the heart, in the muscle itself, the heart muscle itself, or the membrane around. So that's what you most commonly hear probably when you have the flares that are with either chest pain or palpitations, that they say, oh, it's pericarditis, there's fluid around the heart. So that's one of the most commonly flares of the heart itself that we see in lupus. That can happen in up to half of people, that there's fluid around the heart, that inflammation, pericarditis. And it's something that's easy to see with an echo. They just put the ultrasound and they can see that. But when it's other parts, for example, the muscle itself, that's harder to see because you would only see it abnormal in simple imaging like that if it's not working well. But it means for it to not work well means that it must be damaged already, not just inflamed. So if we want to pick up things of like inflammation in the heart muscle itself, that, needs fancier testing, like the MRIs are one of the ways that we can see that, because we want to find inflammation, right? We don't want to find like damaged scar tissue that we cannot reverse and treat. So then that needs further testing, like MRIs, for example, or a special type of CAT scan called a PET-CT scan that actually shows in orange areas that are inflamed. So that's like somebody that had inflammation in the heart, and you see how it lights up like that. So that's a really nice test to do that. But of course, you need to have some suspicion because you're not going to be having CAT scans at every visit and so forth. So it's a bit trickier to diagnose when it's not such obvious parts of the heart. but important to have high suspicion if some symptoms are happening, of course. And other things, especially when we were talking about when the kidneys are not regulating your electrolytes, the potassium could be very high. That puts our heart at risk for funny rhythms. It might not be, keeping the proper, regular, organized rhythm. And if the heart starts having a disorganized, dysregular rhythm, that's what's called arrhythmia, then we're at risk for complications, heart attacks, strokes, when the heart doesn't have a normal rhythm. But this one is really easy to pick up because we can just get an EKG, and it's something that's available in most clinics. And, any heart kind of symptom, palpitations, chest pain, anything, we can just get an EKG, and that tells us nicely how the rhythm is doing. Sometimes we can do like a Holter monitor, if you've seen that. Some people wear something for a couple of days just to give them a chance to capture the rhythm for longer periods of time, and that's also something that can be done if there's a suspicion for funny rhythms. And I just wanted to mention this because I feel like sometimes we're not sure when something could be a cardiac symptom. When is it really your heart from how you're feeling? And those EKGs are quite simple and easy to get. And just looking at some early even studies, people that have not had lupus for more than a year, even up to 30% of the people can have some abnormalities in the EKGs. So it's important to recognize because it's something that you can simply diagnose with an EKG and monitor and see if it changes or worsening, and usually available in all clinics. So it's something good to check. So with that, I'll leave you with this take-home points. And I don't mean for any of this to be scary, but rather than to know that because these things can be going on and we can monitor for them, we can also then detect them early. And we can have interventions earlier. But really, any part of the heart could be involved in lupus. We more commonly know and are aware of the pericarditis, that inflammation around the heart with fluid, because that's easy to see in the ultrasound. But we have to also know that it could be the heart muscle itself and other things that, are not as easy to pick up like that, but can certainly be investigated if there's enough suspicion. And also that, it's the heart itself, but also the blood vessels. And we know that that phenomena of fatty accumulation on the walls of those blood vessels that could also increase our risk for cardiovascular disease in lupus. And you saw how lupus itself, all the other risk factors also contribute. You smoke, have high blood pressure, high cholesterol, all of that also, it's a risk factor. But lupus itself, and I think a lot of it comes because of that inflammation that comes when you have a lupus flare, that lupus itself, it's a risk factor for heart disease. So important to keep an open eye, open ears for anything that could be suggestive of any involvement of the vessels or the heart itself that we can try to identify early and intervene.